Yeah? Really? Oh, that's nice. Yeah, tell me more. Yeah? Yeah? Tell me more. Tell me more. Yeah, tell me more. I think it's hard to get any baby started nursing. There are always challenges in the first few weeks. And so I want to encourage you not to confuse the normal challenges of establishing a nursing relationship with things that have to do with the cleft. For example, of my other 3 children, I had one baby that was choking and spluttering all the time. At the beginning, because the letdown didn't quite correspond with her ability to swallow. And if that had happened with Jacob, I probably would have immediately attributed that to the cleft palate. There's also the difficulty of getting them to open their mouths wide and to latch on properly, and that happens with babies that don't have a cleft, or that they put their heads the wrong way. There are going to be some kind of challenges probably even without a cleft, and I think it's great to brace yourself to go ahead and persevere through those for the first couple weeks, because every single day that you nurse your baby is a huge success. It's a milestone to be able to nurse a newborn baby for a day, and it gets a lot easier once you establish it and the baby gets used to what you do and you get used to the baby. So if your baby is like Jacob and doesn't get good suction, or you can't get him attached well, for a regular baby, you'll get the advice to take them off and try attaching again and try to get them to open their mouths really wide and take their chin down. And I couldn't get that to work for Jacob, but if I would attach him any way he would attach, even with his mouth not very open, then I would press him in toward my body and draw him down diagonally a little bit so that his upper lip is just barely covering. It's a little bit above the nipple, and then I can press him in on the bottom to force his lower jaw down further and make him open up wider. That seemed to work really well. And then if he wouldn't start sucking, I would just squeeze my breast like this with the hand that I'm using to hold the breast in a rhythmic way to sort of get the drips coming in, and then he'll automatically start swallowing them and get going. When Jacob was 2 days old, I was given this Haberman bottle to feed him with, although I actually thought that the nursing had worked fine the first day, but I was worried about him maybe not getting enough because I was told that cleft palate babies basically can't nurse. What you do with this bottle is you put it all the way into the baby's mouth, and then you can squeeze on this reservoir to supplement the milk that the baby's able to suck out or press out of the nipple. And when I looked at this bottle, I thought, what's the difference between holding my baby's head here, holding something into my baby's mouth and squeezing on it like this, or holding my baby's bed here and holding my breast here and squeezing a little bit as I press it in? It didn't really seem like there was necessarily a difference, because I knew from the Lalesh book, The Womanly Art of Breastfeeding, that it's possible to hand express milk from your breast, which I had never done before, but I knew that that was possible. So it seemed to me worth a try to just set the bottle aside and see if I could achieve the same effect with my breast. When I have my hand on my breast to assist Jacob from the back, sometimes I just put my hand in like this and lift the breast a little, and that's enough to keep the nipple from falling out of his mouth. And sometimes I press the breast at whatever angle I think seems to help me get the most breast tissue into his mouth. If you take a look at this bottle, the nipple on this bottle is really long. A human nipple isn't like that. And I thought to myself, if that's what works for cleft palate babies, maybe if I try to get a little bit more tissue into his mouth, it'll be far enough in without the suction for him to be able to express the milk with his tongue. So there can be some additional challenges to trying to nurse with a cleft. For example, in Jacob's case, he gets almost no suction. So I, out of curiosity, tested whether he could use a normal bottle, and he can't. He can't use the normal nipples, even if the hole is very large. He can't keep his mouth closed around it and can't suck. But I think there's a misconception a lot of times that nursing mostly involves suction, and it doesn't. The suction helps with the letdown response, but you can get that many other ways too. As you probably know, the milk can let down even when the baby's not there. And the suction that's required to hold the baby on while they're expressing the milk is actually expressed by the tongue pressing against the hard palate. And so once the letdown response has occurred, the baby just needs enough suction to stay on and keep the nipple back in the mouth. And you can basically compensate for that pretty well, at least with some anatomies apparently, by pressing the baby in and just holding the baby there, the same way as you would do if you were feeding the baby out of a bottle. So if I put my finger in Jacob's mouth, it definitely feels very different from my other three babies. With the other three babies, it felt like they were almost sucking your finger down their throat. The suction was so strong. And with Jacob, it's not like that at all. If you don't put your finger right in the center of his mouth, he can't necessarily even keep his mouth closed around your finger. And if I want to stop nursing him, I just let him fall off. With the other children, I had to put a finger into the mouth to break the suction so as not to hurt the nipple. I think that it's very important when you have a baby that has a defect like this that involves feeding, not to let yourself get psyched out by worrying whether or not the baby's getting enough, but just to find out whether he's getting enough. So when I said that I thought that Jacob was nursing successfully, I was told, be careful that you don't confuse him being satisfied with him being lethargic. Panic button. That is not what a new mother wants to hear, because of course a top concern is my baby getting enough food? Am I starving my baby by trying to breastfeed my baby? And one solution I had to that was to borrow a scale from the clinic where we take our children for regular checkups, and then in whatever he was wearing, with the diaper partly full or not, doesn't matter. You weigh him immediately before, and immediately after you attempt to nurse him, and then you can tell exactly what the baby is getting. And you can compare it to the bottle feedings that a baby is supposed to be given and see if it's something similar, or if he seems to be nursing but nothing's really going in. If you see the baby swallowing, I suspect that something's going in. But I was really even worried about that at the beginning, because the feeling of possibly not feeding your baby is so strong that it can make you overlook even really obvious clues like that the baby is swallowing. I think it's really important to surround yourself with a few people at least who think that the breastfeeding is really valuable and are willing to support your attempt to do that. Because the voices you hear about cleft palates are saying things like, if you can nurse, you're the exception that proves the rule, or this is really extraordinary. If you have a voice that tells you that it's probably not going to work, or that it generally doesn't work, it's extraordinarily hard to get it going. And I had the good fortune of having 3 or 4 people around me who either had seen Jacob nursing and said, he's clearly nursing, don't worry about it, or who thought that it was worth the trouble of struggling through to see if he could nurse or not. And that helped me a lot to set aside the anxiety that maybe he wasn't getting enough, to give it a good try. I have a few ideas for how to assists your body in letting down the milk if your baby's suction doesn't help you do that. I think it's really unnecessary. You can get a letdown without the baby doing anything. And then the milk is sort of ready to go, and then they can express it out using the tongue against the hard palate. And I use all sorts of psychological tricks, images, a little song about milk flowing out. You can imagine your breasts filling up with milk in all the ducts and how it's running out. You can smell your baby's head. Draw your baby really close and close your eyes and smell the baby's head. And in your particular situation, you can find things that work for you. But especially once you start to get something that works, then it tends to work over and over. So if you imagine a little song when your milk is letting down, then after a while, when you imagine the song, the milk will let down. Kind of like Pavlov. So even if something doesn't work perfectly in the beginning, I would encourage to keep trying something and keep working on trying to get a letdown. One thing that you can do is pretend like you're going to express the milk by hand, and you can massage your breasts, stroking them like this, or going around and around, or shaking them and knocking them together. Those were ideas that I came up with after looking at the book, The Womanly Art of Breastfeeding, because they had other ideas too. I think the book is a great book for getting ideas. I thought this book, The Womanly Art of Breastfeeding, was an excellent resource, and I didn't know anything about breastfeeding when I had my first child, and I read this book and got the idea that breastfeeding for years instead of months could be a really healthy thing for my child and a really great way of bonding. And I would encourage you to look at other parts in the book besides the cleft palate part. The cleft palate part is really short, but there are lots of other ideas in the book that could be useful if you're a little bit creative and curious about hand expressing the milk and about all different sorts of holds. In my case, I learned about tandem nursing for the first time from this book, and I tandem nursed all my children. I actually discovered when I was tandem nursing Jacob with my toddler, which I did with my arm up like this so that her head could fit, she just sat next to me, that I didn't even really always need this hand holding Jacob on. And I would encourage you also not to think of whatever you're doing as either or, this works or doesn't work, but just adjust, adjust, adjust. For me, getting rid of a chair and sitting on a yoga mat where I have a little traction and can use my feet, propping up my legs like this for support and setting the baby in, and definitely getting rid of any bras, which I did actually with my first baby because that contributed to clogged ducts for me. Adjusting in whatever way works for you is really important. I used this syntocinon to get the breast pump to work for me. I had troubles getting anything out of the breast pump. The first 3 times I tried it, I got out about 1 drip. It was very discouraging. And then I remembered that I had used this oxytocin preparation called syntocinon when I had clogged ducts before with the other children a couple times. And so I got a prescription of it. You squirt it up your nose, one nostril or the other, and a couple minutes later, all the milk runs out. And I used this twice with the breast pump and got out plenty of milk. And oddly enough, after that, my breasts had gotten used to the pump, and I could get the milk out even without using this. So that was a great step forward. I think it's really useful not to think either or. Either I'm going to breastfeed him or I'm going to bottle feed him. Either I'm going to bottle feed him with milk or with formula. But to give yourself the space to see what happens. It's such an unusual situation to discover that you have a baby with a cleft and that you need to adapt to it. And I actually had a lot of problems combining bottle with breastfeeding because I would be so anxious about how much he was eating that I would feed him, after nursing him, I would feed him with the bottle a little bit more than he probably wanted to eat. And then the gap between the next time he would nurse would be getting longer and longer so that he didn't want to eat that much the next time. He was kind of overstuffed. And then I would feed him more out of the bottle because it was a lot easier to get it in that way, because he doesn't have to be as active, or you can kind of be more suggesting in getting him to take it. So that what started out as 80% breast and 20% bottle, for example, started to end up the other way around, where I was mostly feeding him from the bottle and he was just taking a little from the breast. And for me, the breast pump was very unreliable. Sometimes I would get lots of milk out and sometimes not very much at all, for reasons that weren't really clear to me. So I realized that if I didn't take the leap and just go ahead and try to breastfeed him, I was probably going to end up feeding him formula because I couldn't get the milk out as well with a breast pump as the baby could get it out, which is not really so surprising. He looks sweaty and linty. Certainly not camera perfect. We don't need to be perfect, do we? No, just get the message across. I'm really glad that Jacob can breastfeed exclusively, but I'm not super mom, and it didn't work because I persevered and believed I could do it and struggled through all the difficulties. In fact, when I found out in the beginning that he probably couldn't nurse, I believed that for quite some time. And so I would encourage you just to play around with it and keep trying this or that and give yourself a few weeks to keep an open mind about what your baby might be able to do and what you might be able to do. And let's just wait and see what happens.